So doctor, it's been my pleasure. I saw your results today. I'm thrilled.
I am too. I just can't tell you how happy I am. You know, you're young enough that you probably don't have to go see lots of physicians, but as a guy in the medical field, you have no idea how frightening it is to have to go see other people that you have heard about, but not necessarily seen exactly what they can do. And from my perspective, there is very little that's scarier than having either open heart surgery or eyeball surgery. And so I guess my feeling is I had two really good consults to come see you, one from a retired Navy ophthalmologist and one from a retinal specialist. So I guess my question is how come other guys can't do what you do?
Well, again, these are impromptu, I call these grill me sessions.
Yeah.
I don't think other doctors cannot do. I just feel, and this is what I've encouraged them for the last 2 decades as I teach all over the world, I feel they can do. It's just that the attitude of the fear on seeing someone like you. Like in your case, your complexity is you have multiple RK incisions and scars.
Right.
In addition, you had very advanced cataracts. In addition, your pupils don't dilate because you on Flomax and the pupils stay very small. All these things make your surgery very difficult, besides making it unpredictable, meaning mathematical outcome.
Sure.
On top of that, you're a surgeon with over 30 years experience. So all these things doctors look at and they go, oh, this is difficult or impossible.
Well, but I guess that in many ways then you're telling me that a lot of the guys are like they're back in the 1500s where the world is flat and they can't see going over the curve.
I just feel they've been taught so much that such complex cases don't see, that their attempt may not be as hard. So my pleasure today, my payback is that you're seeing 20/20 without glasses, distance and near.
Yeah.
And to me, again, it's not like I'm a magician, it's just that I believe when I see you, I look at all the difficulty levels and I go, that doesn't decrease my desire. My desire still is I want every drop of vision you have.
Yeah.
So our audacity in going into this surgery and planning a toric lens implant, putting it on axis, coming out without stitches, even with your multiple incisions, and putting you back into your professional golf and surgical career, to me that's my payback. So I believe that payback is so strong for me, the incentive is so strong, that I don't want to give up, and I cannot see you seeing less than what I want. Does that make sense? I mean, you're a surgeon,
Sure.
but this is how I see
You know,
it.
I mean, I remember too, talking to you pre-surgically, and it came to me that you were easily thinking outside of the box, as opposed to we got this little case and this is it. Because my eyeballs don't fit in there; they're everywhere else, and so you're having to do your own sculpture, if you will. You know, I already told you once, I'll tell you again. I truly believe that you're an artistic engineer with good hands, and if you can't think outside the box the way an artist can, and from an engineering standpoint you can't plan exactly what you're going to do, and then you can't provide the fingers, you just can't do it. And I think you do. So I am very grateful, and I want to formally thank you.
Thank you so much, Ron, for your trust. It's been an honor, absolutely. And you had surgery actually in our office-based surgical suite, not
Yes.
a surgical center, even with all your complexities. So how was your experience there? You
I-
didn't have any drugs, no IV sedation, just
No,
numbing drops?
I can't tell you how impressed I was with that. Number one, we walked in, and your front desk people and your assistants were so welcoming. My wife was obviously waiting to drive me home. Anything she needs, let us know. You know, we're going to take care of it. In the suite itself, the setup was obviously very nice, but I was particularly impressed during the second eye surgery. Just before the start of the surgery, I had to blow my nose, and I said, can I blow my nose? And somebody handed me a tissue, I was able to blow my nose. But whoever your infection control person is said, we need to re-scrub the area. That made a tremendous impression on me, because back in the 80s, I helped write the first Navy guidelines for infection control.
Wow.
I don't remember seeing something like that happen in any other physician's office that I've been to. And, you know, at age 72, I've been in a lot of them. So I'm very impressed. The average patient, they probably never even notice. And they'll walk away with a successful surgery, but they won't understand necessarily, other than the fact that they like Dr. Gulani, and 90% of that is your personality, but the other 10%, which is critical, is your staff's personality.
Yes.
And the success of the eye surgery, I think, is that little suite. But once again, I'm just a retired dentist.
Like I said, I believe every doctor can do this. You are watching an impromptu interview in my institute. It's an honor for me. My relation with my patients becomes like friends, even though they come from all over the world. And I do believe every eye surgeon, every eye doctor can do this. It's just that I want you all to have an attitude of, no matter how difficult the situation or how demanding the personality, it shouldn't change your desire to perfect vision. So with that, this is Dr. Gulani. It's been a pleasure again.
With lack. I am a retired Navy dentist. I've been doing in the medical field of dentistry for almost 50 years. I came to Dr. Gulani because I was referred to him by two other well-known ophthalmologists, because I had fairly exotic radial keratotomies done about 20 years ago, and I had very small pupils, and they said he was the man to visit. My vision was getting very bad. I was losing a golf ball on a regular basis in the clouds at 50 to 75 yards, and I was getting frustrated. I also, as an oh by the way, had to wear reading glasses to read, but that was not such a big deal. I came to see him and we talked. And I have to tell you how impressed I was, because in my opinion, granted he is a physician, but he's also a very artistic engineer. He has the ability to think out of the box the way an artist does. And then from an engineering standpoint, he had the ability to go in and reconstruct my eyes so that I could see. And right now I am 20/20 distance and near. So life just doesn't get any better than that. I have to tell you, he's got two really spectacular secret weapons. One, he's got a staff that make you feel like you're visiting friends. They are so good, it's just amazing. And they couldn't have been more helpful to my wife when I had surgery. His little surgery suite that he has that's next door is really immaculate. And I will tell you that in the late 1980s, I helped write some of the Navy guidelines for infection control. And that suite is pristine. And there was an episode during my second eye surgery where I had to blow my nose. Whoever was his rotating surgical consultant as far as infection control is concerned stopped everything and said, we need to rescrub this area. I would have never seen that in any other physician's office, and I've been to a lot of physicians' offices. So, bottom line, would I recommend the man? In a heartbeat. He's the guy that I would visit again. I'd send my family to him. It was a terrific experience.